are the symptoms of other viral infections or autoimmune diseases that involve dysregulation of the immune system by making use of the CD147 receptor more severe as compared to the symptoms of long COVID. Please give an overview of some important examples. The severity of symptoms of other viral infections or autoimmune diseases that involve dysregulation of the immune system via CD147 can vary and may be more severe or less severe than those seen in long COVID. For example, the symptoms of dengue virus infection can range from mild to severe and can progress to a potentially life-threatening form of the disease known as dengue hemorrhagic fever. In contrast, symptoms of long COVID tend to be more persistent, but less severe than those seen in acute COVID-19 infection. In the case of autoimmune diseases, the severity of symptoms can also vary widely depending on the specific disease and the individual affected. For example, in systemic lupus erythematosus, SLE, a chronic autoimmune disease, symptoms can range from mild to severe and can affect various organ systems, including the skin, joints, kidneys, heart, and lungs. In contrast, the symptoms of long COVID tend to be more focused on fatigue, muscle pain, and brain fog, but can also affect other organ systems. It is important to note that the severity of symptoms of other viral infections or autoimmune diseases will depend on a number of factors, including the individual's underlying health status, the specific virus or disease, and the stage of the infection or disease. Further research is needed to fully understand the comparative severity of symptoms of long COVID and other viral infections or autoimmune diseases that involve CD147. Let's analyze only the mechanism of long COVID, which causes a dysregulation of immune signaling pathways triggering overproduction of pro-inflammatory molecules. Please give an overview about the current state of knowledge, how the COVID virus triggers the CD147 receptor, and which pro-inflammatory molecules are produced. The mechanism behind the dysregulation of immune signaling pathways in long COVID is still not well understood, but it is believed to be related to the activation of the CD147 receptor. SARS-CoV-2 is thought to interact with the CD147 receptor in some way, potentially through its spike protein, to trigger overproduction of pro-inflammatory molecules. Studies have shown that the overproduction of pro-inflammatory molecules, such as cytokines, in long COVID can lead to persistent symptoms, such as fatigue, muscle pain, brain fog, and shortness of breath. It is thought that this overproduction of pro-inflammatory molecules may contribute to the ongoing inflammation and immune activation seen in long COVID. However, the specific pro-inflammatory molecules that are involved in long COVID and how they contribute to the persistence of symptoms are still not well understood. Further research is needed to fully understand the mechanisms behind long COVID and the role of the CD147 receptor and pro-inflammatory molecules in its development. As concluded earlier, no other virus besides COVID uses both of these mechanisms in parallel. ACE2 for host cell infection and virus reproduction, and CD147 for dysregulation of immune signaling pathways in long COVID cases. The uniqueness of the COVID virus mainly stems from the particular ability of the COVID spike protein to trigger the CD147 receptor and interfere with immune signaling pathways. Therefore we conclude that actually the COVID spike protein triggers the overproduction of pro-inflammatory molecules. And it is the key to the uniqueness of the COVID virus. Please inform us about the current state of knowledge about the question. In which cases can the COVID spike protein cause harm through the CD147 receptor signaling pathway? Without that, an acute virus infection is present, and without that the ACE2 mechanism is ongoing. Please give a brief overview of important examples, like spike proteins circulating in the blood together with remainders of dead viruses. It is currently not well understood if the SARS-CoV-2 spike protein can cause harm through the CD147 receptor signaling pathway in the absence of an acute virus infection or ongoing ACE2 mechanism. Some studies have suggested that the spike protein, or fragments of it, can persist in the body after a COVID-19 infection and potentially contribute to ongoing inflammation and immune activation. However, this is an area of ongoing research and the evidence is not yet conclusive. It is also not yet clear if the spike protein circulating in the blood, potentially as fragments of dead virus particles, can directly interact with the CD147 receptor and cause harm. Further research is needed to fully understand the role of the spike protein in long COVID and if it can contribute to the dysregulation of immune signaling pathways in the absence of an acute virus infection. There is a scientific article about a potential non-infective mechanism of COVID microvascular disease, which disrupts the human cardiac pericyte's function through CD147 receptor-mediated signaling. The article says that exposure to the spike protein alone elicited signaling and functional alterations, including secretion of pro-inflammatory molecules typically involved in the cytokine storm and reduced ability to support endothelial cell network formation. Those signaling and functional alterations are elicited as long as the spike protein is circulating in the blood and can surpass the duration of an acute COVID infection. Concluding, the spike protein alone causes dysregulation of immune signaling pathways in long COVID cases which already are cured from the acute infection. Yes, that is a possibility that has been proposed by some research. The spike protein of SARS-CoV-2 has been shown to interact with various host receptors, including the CD147 receptor. And this interaction may trigger signaling pathways that lead to inflammation and functional alterations, as described in the article you mentioned. However, it is important to note that this is a topic of ongoing research and the evidence is not yet conclusive. Further studies are needed to fully understand the mechanism of how the spike protein contributes to the development of long COVID and the potential long-term effects of the spike protein exposure. It is also important to keep in mind that the complex pathophysiology of long COVID likely involves multiple factors beyond just the spike protein. The COVID vaccines trigger an immune response by the synthesization of the COVID spike protein through the injected mRNA. Can we conclude that the spike protein synthesized through the vaccine shows the same interactions with various host receptors, including the CD147 receptor? And this interaction may trigger signaling pathways that lead to inflammation and functional alterations. As described in the article, it is still not clear whether the spike protein synthesized through the COVID vaccine would have the same interactions with host receptors, including CD147, as the spike protein from the virus. Some research is ongoing to understand the interactions of the vaccine-induced spike protein with host receptors. At present, the available evidence suggests that the vaccine-induced spike protein is not as potent in triggering immune signaling pathways as the viral spike protein, and the vaccines are generally considered safe with rare adverse effects reported. However, it is important to continue monitoring the safety and efficacy of the COVID vaccines, and further research is needed to fully understand the potential interactions of vaccine-induced spike protein with host receptors. The vaccine-induced spike protein maybe has a lower potency in triggering immune signaling pathways as compared to the viral spike protein. However, inflammation and functional alterations through the CD147 signaling pathway, even if rare, can cause severe adverse effects and long COVID for certain individuals. How would a human individual, which is subject to such a rare severe effects, stop the mechanism of dysregulation of immune signaling pathways caused through the vaccine indices? Spike protein? Please give a brief overview of possibilities how to block the CD147 receptor, such that the spike protein is not able to trigger it, and explain the difference in the recovery protocol for people who recover from long COVID induced by the viral spike protein and from vaccine induces spike protein. The vaccine-induced spike protein may interact with host receptors, including the CD147 receptor, but the likelihood and severity of these interactions are still being studied. Currently, there is limited information available on how to block the CD147 receptor specifically to prevent the triggering of immune signaling pathways by the spike protein. While some drugs that target pro-inflammatory molecules and signaling pathways have been used in the treatment of autoimmune diseases, the treatment of long COVID induced by the vaccine-induced spike protein may differ from long COVID induced by the viral spike protein due to the potential differences in the mechanisms of action of the vaccine-induced and viral spike proteins. Further research is needed to determine the best approach for treating individuals who experience adverse effects from the vaccine-induced spike protein.